wanted to talk about the management and pain management of hernias before and after surgery. After doing research, we realized that there are several different types, so we decided to choose the three that are most commonly seen in healthcare, which are inguinal, umbilical, and hiatal hernias, inguinal being the most common. Hernias occur when an organ or fatty tissue squeezes through the surrounding tissue wall, and it causes the patient to have to seek medical treatment. Oftentimes, hernias are not life-threatening, so medical treatment may just be waiting it out, but in more serious events, it can cause the patient to have to undergo surgery. From this group clinical teaching project, we would like our patient to understand what a hernia is, the pain regimen that goes along with hernias, and the different treatment options available that they have.
There are different types of hernias, including hiatal, inguinal, and umbilical, and these hernias are just dependent on the location and where they are on the body, if it's close to the groin or umbilicus, and the primary care doctor would typically be the person to diagnose the hernia and what type of treatment would be needed. Some risk factors include older age, being a male, doing strenuous activity, and a hernia is basically where the tissue bulges through the abdominal muscles. And when patients in the hospital present with a hernia, there are different options, including watchful waiting, meaning that potentially the hernia will get better on its own, which typically doctors don't really see that in the hospital, and referrals, analgesics, injections, and then surgery is always the last option. If a patient has surgery, it's important to educate the importance of a diet that includes eating soft foods and an increase in fluid intake to help peristalsis and bowel movements. And eating soft foods is important because of the swelling that patients may experience typically after this invasive surgery.
There are many different types of treatments, with the most common one being surgery. A mesh will be used in these surgeries, and there are two different types, and those are laparoscopic reconstructive repair and Lankenstein repair. The weight and type of adhesion used for these procedures directly affects the pain levels the patient has as well. Levels and management of pain are vital to include when discussing the differences between these repair surgeries. It is important to talk about these different types of surgery options in order to educate the patient on what route they need to take in order to reduce pain and have the quickest recovery. The knowledge level of hernias is dependent on internet access people have around the United States and the world. People who are unable to access the internet will be a lot more ignorant of hernia care and management than those who are able to have that access, so it is important to keep that in mind when educating your patient.
Our concept article discusses how to manage post-surgical pain from a hernia repair. According to the study, 16% of patients experience chronic pain following the repair that can affect their lives for the next 6 months. The treatment option should be personalized to the patient and the characteristics of the pain that they're experiencing. Initially, before the surgery, the patient has the ability to decide if they would like to wait to see if the hernia resolves itself or if they would like to undergo surgery. The majority of hernia patients will end up needing a surgical hernia repair, regardless of if they decide to wait or not. The most common option by surgeons is to use a mesh. The two types of mesh treatment are the Lichtenstein repair and a laparoscopic repair. The laparoscopic repair is known to cause less chronic pain following the procedure due to being less invasive. Post-surgical pain can result from multiple events. The weight of the mesh used can be a factor in the level of pain, along with the substance or mechanism used to secure the mesh. Certain adhesives like glue can reduce the likelihood of chronic pain instead of, say, tacks. The article shares information about how the hernia causes pain within the patient. In some surgical circumstances, tacks are used as the adherence method. These can sometimes cause nerve damage or organ damage, which can result in neuropathic and nociceptive pain. The mesh can also shrink into a small ball, forming what they like to call a meshoma, which can also obstruct certain body functions or pinch nerves. When assessing the patient for pain, the nurse should be aware of any repetitive types of pain. This could indicate an underlying cause that could be repaired separately and therefore help improve the patient's level of pain. The article shares ways that nurses should assess their patients for pain. Assessment should include focused questions about how the pain affects their quality of life and their ability to accomplish small day-to-day activities, or their ADLs. If non-pharmacologic interventions are not improving the pain level, medications can be prescribed to further maintain the pain. This article provided a thorough review of the characteristics of hernia repair, treatment methods, and post-surgical interventions.
Health literacy is no doubt a vital part to access to patient-centered, good quality evidence-based healthcare. So the article that my group and I read discusses the definition of health literacy. They tell us that it is the individual's ability to comprehend basic health information needed to make appropriate medical decisions and use appropriate health information. So health literacy has been found to really closely relate to health outcomes. And essentially, it assesses a patient's ability to comprehend their medical condition and then moves forward to help them help themselves better. Low levels of literacy contribute to increased costs, increased admissions, decreased quality of care, and reduced compliance. So the article that we read discusses several studies investigating Google searches related to different procedures. The article first talks about how 74 to 78% of Americans use the internet. Of adults that use the internet, up to 80% of them use it to search different medical conditions. The study also looked at different documents and assessed their readability. Essentially, the readability of a document is defined as the minimum required reading comprehension level necessary to understand a written material. And it also talks about that there are many different formulas used to determine readability. The article talks about how the most important readability formulas include the Frye readability graph, which is used by the Centers for Disease Control, otherwise known as the CDC. So in essence, the study found that individual surgical subspecialty online patient materials are consistently above the recommended reading level of 6th grade. All top surgical specialty patient materials were at least a 9th grade reading level across all different readability scales. So with greater access to the internet, it's essential to evaluate the quality of health information currently available, along with how people are able to interpret that information. Obviously, science and technology combined are moving towards providing health literacy in an online format. Achieving patient comprehension is the ultimate goal of online health information, and the article is suggesting that readable literature is the first step, and we do not have current recommended readable literature. Having readable literature for even the most complex of diseases is essential to making strides toward improving patient outcomes.
Hello, my name is Theresa. I'll be your nurse today taking care of you. Can you give me your name and date of birth?
Yeah, it's Matthew Heckart. My date of birth is 4/17/2001.
Great. Now, do you understand your diagnosis of your hernia?
Not really. Could you explain it a little bit more for me?
Okay. First off, to gain an understanding of what you do know, can you tell me what a hernia is in your own words?
I don't really know what it is. I just know that it causes like a small bump by my stomach.
Kinda. Good start though. A hernia is essentially an organ that bulges in a spot it's not supposed to, creating the small bump you were referencing before. There are a few different types of hernias. Let me grab my teaching tool to help you better understand this diagnosis. Here are the 3 common examples of hernias you might typically see. First, we have the hiatal hernia, where the stomach bulges up through the diaphragm at the base of the chest. Next, we have an umbilical hernia, where the intestines bulge through the abdominal region near the belly button. Next, we have the inguinal hernia, where the intestines bulge through the abdominal region in the groin or scrotum area. Do you know which one you have?
I think the doctors came in earlier and said that I have an umbilical hernia, because I have like a small bump near my belly button.
Okay, based off of where it's located, that's correct. So typically there are 2 different approaches for the treatment plan of someone with a hernia. You could wait to see if it goes away on its own, which might take some time, or you could have surgery or a procedure done in order to fix the hernia. Are you doing anything currently to manage your pain?
Yeah, I'm taking a little bit of Tylenol to, help reduce my pain, and then also I'm just kind of taking it easy, sitting on the couch, not moving a ton, because it hurts to move. I'm pretty sure the doctors came in earlier and discussed treatment options with me, and I believe that I'm going to go ahead and have surgery to repair my hernia.
Great, off to surgery you go. Hi Matt, I heard your surgery went great. If now's a good time, I would like to discuss some things to manage your recovery after surgery.
Okay, great.
Great, your diet is normal. If your stomach gets upset, you can try some bland, non-fat foods such as boiled chicken, plain rice, or toast. Do you have any cultural requests for me so that I can accommodate your requests appropriately?
No, I don't think so.
Okay, well also make sure that you drink plenty of fluids and wait 24 to 48 hours before taking a bath or shower. And when you do take a bath or shower, make sure to pat the incision dry so it doesn't open. To help with pain control, you can also ice your abdominal surgery for 24 to 48 hours after it. Also, please do not swim for 4 weeks. Wear loose-fitting clothing around the incision site for at least 7 days. And after that, just make sure to take it easy and do not overstress your body. Do you have any questions about what we spoke about today?
No, I don't think so. Thanks.
Great, I hope you feel better. It's been a pleasure taking care of you.
So health literacy is very important regarding patient teaching, because if a patient doesn't fully understand what we're teaching them, they can struggle to care for themselves on their own, and they may have questions about what activities they can and can't do. Overall, if a patient's not literate on their condition, then there can be more harm than good. They could tear a suture, they could get infected wounds. So as a basis for assessing a patient's literacy, the nurse can simply do something like ask the patient if they understand. If not, there may be more teaching needed, and if the patient states that they do understand, then ask them to recite what was explained. If there are specific instructions, then it is also beneficial to have the patient demonstrate that they understand. If the patient states, I can't wait to go swimming tomorrow when I get out of the hospital, or so I can shower before bed, or they can't wait for the marathon tomorrow, let them know that it may not be a good idea after a hernia repair, and they may end up needing more teaching. To continue assessing if a patient has any questions or during any part of their care, then these need to be answered and ensure that the patient now understands. If a patient's unconscious or unable to understand their condition and recovery process, it's also important to inform their caregiver or their support network, as well as assess their level of health literacy.
In conclusion, health literacy is extremely important in the healthcare setting. It is an important role of the nurse to ensure that the patient understands their diagnosis, treatment options, and possible outcomes for their hospitalization. Specifically for a hernia, we need to make sure that our patient understands the symptoms of their diagnosis, as well as the preoperative and postoperative treatments that are necessary. As nurses, we need to be culturally aware and accepting of a patient's beliefs. Our hope with this video was to help the nurse better understand the idea of health literacy and cultural competence, as well as the proper management and treatment of pain and symptoms related to the hernia injury.